Today, again, we have the honor of having a medical practitioner with us in the studio where we would have this healthy conversation talking about the osteoarthritis. This happens to be a day that is recognized all over the world, and every year it comes up on the 12th of October 2024. 2 more days to this very big day called the World Osteoarthritis Day. This is a day where it is important for every individual out there to understand that the health, the body system, most especially the joints and the tissues, putting the bones and the joints together needs proper maintenance. The point at which this maintenance are not properly done, then we can tell you that there will be an issue. To avoid this issue, that is why today we have decided to join the rest of the world to mark the World's Osteoarthritis Day, a day being set aside for every human out there to take cognizance of their health. I am Opeyemi Adebambo, your uncle for today on the issues, alongside the friend of the house. He's a medical practitioner who sure knows his onions well, talking about Dr. Oloyede. He's been in the studio before, not just this time around. He has delivered, and of course today he would sure deliver as we mark the World Osteoarthritis Day every 12th of October in every single year. The World Health Organization have also decided that this day should be a day of great importance to every individual out there. Having said this, it is okay for me to turn on the microphone and welcome my guest from General Hospital Ikorodu in person of Dr. Oloyede. Good morning to you and thank you for joining us, sir.
Good morning, Dr.
It's good to have you again in the studio.
Thank you very much. I remember our last interaction was very interesting.
And definitely, I am hoping that today will be same.
Yeah. Once again, we have the opportunity.
Yes, and I must say you're looking radiant and smart.
Oh, thank you very much.
Welcome to the studio. So you've heard the voice of Dr. Oloyede today while we will talk about the World Osteoarthritis Day. First off, let me ask if I am correct with the pronunciation of the Osteoarthritis Day. Hope that is okay.
Yeah, you are right. Yeah, you are
right. Thank you very much. So today we want to talk about this day, but it's important for us to first start with the word osteoarthritis, breaking it down to its simplest understanding for people out there who might be very confused that what is Opeyemi saying, what is he talking about this morning. When we talk about the osteoarthritis, what does it actually entail?
Yeah, thank you very much, the good poor of Ikorodu and Lagos State. The word osteoarthritis is a combination of two words.
Okay.
Osteo means bone.
Hmm.
Arthro stands for joints. So when you say osteoarthritis, you are talking about the joints. Then arthritis or anything that ends with TIS has to do with inflammation.
Inflammation.
Yes, that means swelling, pain, and all those stuff. So when you combine the word osteoarthritis, it means that inflammation or something that has to do with the joints that may lead. I'm just trying to be as simple as possible.
Yes.
Something that can lead to pain, swelling, and discomfort in the joints. So when we talk about osteoarthritis, it can occur in any parts of the body where you have joints. What is a joint? A joint is the meeting point of any bone.
Okay.
Any two bones. It can be in the shoulder, it can be in the knee, it can be the hip, it can be the ankle. So these are joints. And wherever there is joints, there is what? Movement.
Sure.
So in the process of movement, there is wear and tear. It's just like your car. Most of us, we have cars. When the mechanic will tell you that your ball and socket joints, you're close to the tire or the hazard, is worn out.
True.
So you have to change it. The same thing applies to human joints. So wherever there's a joint, then there's also a high possibility that you may have osteoarthritis.
Thank you very much for that breakdown and explanation. Please, I would crave our indulgence if you're listening that you need to learn from this particular conversation today on the issues because like our doctor has rightly said, wherever there is a joint, there are possible, reactions of pains or swollen from this part. And this is what, a lot of people out there faces. Now, Dr. Oloyede, I want you to put us through when we talk about arthritis. How is it like living with arthritis? How deadly, how terrible, how dangerous is the word arthritis itself? And how can you also still help us explain and understand arthritis, because this is another illness that many people do not even take seriously.
Well, like I've said earlier,
Mm.
any parts of the body in which there's movement and there's a joint, there's a high possibility of having osteoarthritis. Of course, there are various joints in the body. You have the small joints, you have the big joints. The small joints, the ones in your fingers,
Oh, okay.
between those small bones, there are joints there. There can be osteoarthritis there. Then we'll now come to the big joints,
Okay.
such as the knee joints, the hip joints, the shoulder joints, the ankle joints. So all those areas are predisposed to osteoarthritis. Now, when you talk about osteoarthritis, there are different types.
Okay.
And they affect different parts of the body. So let's just make it fast. Let's go to what are the factors, the predisposing factors to someone having osteoarthritis.
Okay.
There are various factors. One, weight.
Weight.
When someone is overweight, of course, you are putting much weight or much force on the joint.
Much load on the joint.
You are loading the joint. It's as if you are loading something that the body cannot cope with.
It's just like a vehicle when there's too much load and you start hearing stories with the shock absorber.
Yeah, shock absorber and the ball and socket joint, linkages. The same thing happens in the human body. So when there's high weight, excessive weight, especially people that are obese, they are more predisposed to osteoarthritis. Another point is the nature of your work too.
Okay.
Can also predispose you to osteoarthritis. People that do work that has to do with a lot of standing, then athletes, sports people that do sports, footballers, so on and so forth, athletes, they are predisposed to osteoarthritis. Then there's also some what we call the genetic factors.
Okay.
There are some people that osteoarthritis runs in the family. Runs in the family, irrespective of age. Out of all these predisposing factors, age is the most important.
I was going to ask you, we're going to get there.
Age is the most important because the older you get, then the wear and tear increases. Then in the joints, you know, when you talk about joints, there are various things that make up the joints. The bone is just one of them.
Wow.
There's something covering the bone, which is called the cartilage.
Okay.
That cartilage is that white, like most of us that like eating chicken or bones, cow, all this stuff. You see that at a particular point, you see that the surface where the two bones meet is white and it's very smooth.
Yes.
So that surface is what you call the articular surface, and that's where the two bones, the upper one and the lower ones, move against each other. In addition to that, there's a fluid inside, called the synovial fluid, that serves to reduce the friction between the two bones. So as one is getting older, your ability to regenerate those cartilage reduces. Also, your ability of your joints to maintain the synovial fluid, production of the synovial fluids also goes down.
Okay.
Then also there are some things you call the ligaments that holds the two bones together. Normally, they are supposed to be very elastic. So as one is getting older, the elasticity of those structures reduces. So there is general tightness, there's increase in friction. So when there's increase in friction, definitely the rate of wear and tear will increase. So osteoarthritis just has to do with wear and tear. So if you are that kind of person, maybe you are a sportsman, footballers, you play for Arsenal, man, those people at some age, they are more predisposed to osteoarthritis because the rate at which they use their joints is higher.
They use it more than others. So athletes are even more prone to osteoarthritis.
They are more prone to osteoarthritis. Osteoarthritis is just one of the injuries they are prone to. There are other things inside the joints. You have the cruciate ligaments, the meniscus,
okay, with what you have said, Dr. Oloyede, looking at the fact that you said that it could be a family thing.
Yes,
Is
it
this
runs in
to say that
family.
yes? Could it not be said that osteoarthritis, is it okay to say it is hereditary?
Yes, yes, you are right, 100%.
Wow.
Yes,
Wow. Okay, having said that, now let's then talk about the age too.
yes.
There is this belief that osteoarthritis is commonly within the older generations. Is this to also say that when you look at the younger generations, they can just feel relaxed and say, oh, it is not our kind of disease or problem.
No,
We don't have to worry about it.
no, not at all.
Mm.
Osteoarthritis, I've seen osteoarthritis in a 17-year-old boy.
As young as 17?
Yes, I've seen in 21-year-old girl. So, but those arthritis, they have a different name for that.
Okay.
Those that occurs in younger age group, adolescent age group. You call that one Still's disease.
Mm.
They're a little bit different.
Mm.
But the general principles that govern them is that there's a general wear and tear of the joints.
Mm.
So it occurs in younger age group, but the percentage is very, very low.
The percentage is very low. When I was going through the research and trying to be sure of exactly what osteoarthritis is all about, I also then discovered that from the start, that is at the early stage, osteoarthritis used to be just a one-way direct thing. But right now, there are different kinds, as it is said, there are different types.
Yes, yes, yes.
So can you just put us through the types and the affected age of this osteoarthritis? Just some of them that you can pinpoint.
So let me just give it just a breakdown so that people can, because the aim of this program is to pass message and make it as simple as possible.
Of course.
Osteoarthritis, basically, it's a degenerative process.
Mm.
It's like you are saying that the joints are aging.
Mm.
And when something is aging, it has to do with advancement of your age.
Mm.
So just as other parts of the body are aging, so also the joints are aging. But right from when you were 12, 13, 15, 25, 35, 40, there's a progressive degeneration. But when you get to a certain age, most people averagely 55 or thereabouts, the rate of degeneration becomes very fast. That's why you see some people, like some of my patients, they will say, I was very fine, I was doing well until suddenly. Usually, someone will say, it's retirement too. It's when I started retirement. When I retired at 60 years, that's when I could not work, I could not do anything. But it may contribute. But within that age of 55, 60, there's a rapid progression in terms of degeneration of those tissues. So also, some people at the age of 70, some people are blessed, 70, 75, 80 years. You see them going around, some of these women in the market, you see those old women, 75, they are still selling their tomatoes, selling their pepper, and doing all sorts. So people have different, the pathogenesis or the pattern is different for different people. So I will just, for this discussion,
yes,
I will restrict it more to the common one, osteoarthritis associated with aging.
With aging.
There are different types of arthritis.
Okay.
There's
all right.
septic arthritis, there's rheumatoid arthritis. So when you come to us, it's our duty as orthopedic surgeons, specialists, to differentiate which of them. Is it septic arthritis? Is it osteoarthritis? Is it rheumatoid arthritis?
Thank you, Dr. Oluyede. Talking about aging as regards osteoarthritis and the fact that from age 50, 60 and above, there are tendencies of these to set in. For the benefit of our listeners, so that there will be no panic whatsoever, is this to say that when a man is 50, then get ready, 60, 70, anytime you might start having osteoarthritis, is it to say that the older generation should expect this to come?
Well, our belief and our prayer is that we should all get old. Because you will not say, because you are scared of osteoarthritis, you want to go on and you don't want to live long. No, it's one of those things. Some people, they may not have osteoarthritis, they may have eye problem.
It could be something else.
Some of them might have ear problem. So aging comes with some natural changes in the body. That's the way God has created it. But some people are privileged, they are blessed. Even at 100 years, you see them going about. So for the older people in their 60s, 70s, it's expected. But different at different levels.
Mm.
The osteoarthritis of a 75-year-old person, Mr. A, may not be as bad as that of a 65-year-old person.
Mm.
So if somebody has been having symptoms of pain in the joint right from 45, 42,
Mm.
you don't expect that person's symptoms to be the same as somebody that started having features of osteoarthritis, symptoms of osteoarthritis at the age of 65, 70.
Mm.
Because as you ages, the earlier the symptoms starts,
Mm-hmm.
the worse the prognosis as you
Mm.
get a little older,
Mm.
especially when nothing is being done.
Especially when nothing is being done. Mm.
So that's why we have to take good care of ourselves.
Now, talking about nothing being done, the major reason for this World Osteoarthritis Day is to create awareness in the minds of people.
Yes.
And that is the reason why you're also seated here. We will talk about preventive measures and how it can then be managed. But before we talk about these preventive measures and how to manage them, can you tell us some of the symptoms now? Because coming out of your words now, you just said that if people start having the signs and symptoms at the early stage, then the repercussion might be worse than somebody who gets it at the later stage. So, what are some of the symptoms that when people start seeing or feeling this way or seeing these things, oh, you should know that this is osteoarthritis?
Well, osteoarthritis generally come with a common symptoms, irrespective of whether it's septic, whatever the type of arthritis is.
Mm.
The first symptoms is usually pain.
Pain.
Yes, pain. The pain may start gradually,
Mm.
but as the joint gets worse, as the injury increases, the pain may get worse with time.
Mm.
Some cases, the pain is so much that the person cannot walk. He cannot get out of his house.
It could be that bad.
It can be that bad.
Wow.
That the patient, in short, some people when they sit down, it's
Hmm.
called post-inactivity stiffness. The patient will sit down, especially when it involves the knee, sitting down like 20 minutes, 30 minutes, getting up would be very difficult. The person is even scared of getting up because of the experience of pain.
Hmm.
Whenever you move the joints,
Hmm.
you stimulate, there are some nerves there, and there's already injury at the surface. So every movement you make, it rubs against the surface and it stimulates the nerves, and the nerve sends pain signal to the brain. So whenever the person remembers, anytime he tries to get up from that position,
Hmm.
sometimes the patient will be scared. Please, I don't want to get to, just let me stay like this.
In
Because
avoidance
of
of the
pain.
pains.
Then the stiffness. Another common symptom is stiffness. Some people when they wake up from their bed
Hmm.
in the morning, getting out of the bed can be very difficult.
Hmm.
Stiffness and pain goes together.
Stiffness and pain.
Pain. Initially pain, then stiffness.
Hmm.
The stiffness is because the cartilage or the joints is trying to resist that movement that leads to pain.
Hmm.
So when you try to move the joints, you stimulate the pain.
Hmm.
Then another symptom is swelling.
Swelling.
In the joints.
Hmm.
The swelling in the joints, those are usually more advanced cases.
Hmm.
Sometimes the joint would appear warm when you feel it because of the inflammation, degenerative changes taking place. There's the release of some substances within that area that stimulates the tissues around there.
Hmm.
We won't go into the cytokines and all those things.
Yeah.
Those are for the medical doctors.
Yes.
To stimulate, and that place will appear warm.
Hmm.
Then deformity.
Deformity.
That means you see the person's knee. It's either he's having a bow leg or a K leg. I'm not saying that all cases of bow leg or K leg.
Osteoarthritis.
Yes, there are many other conditions that can make that. So when you see a case of bow leg or K leg in a 3-year-old child, in a 2-year-old child, 5-year-old child, it's different from having it in a much older group.
When it was not there before.
Yes. So for younger age group, the diagnosis is different, the condition is different. But when I see that in a 75-year-old person, 85-year-old person, 65 years, I'm thinking more of osteoarthritis.
Mm-hmm.
So sometimes you see mama, sometimes it's the patient that will tell you that doctor, you can see this leg. It used to be straight before. I have straight legs,
All
so
of a sudden,
but suddenly the whole thing is bending. K leg or bone of the leg of the legs. So it's there are different symptoms.
symptoms.
So when the person presents, it's not left for the orthopedic doctors or whichever doctor you see to make a diagnosis, do some investigations, because you have to follow. There's a guideline for treatment of people with osteoarthritis.
We will definitely talk about the treatment, but I haven't said all of these things that you've said. If you're listening to us, you can be a part of this conversation by calling us on the studio lines 0904 081 1061 or 0904 082 1061. You've talked about some of the things that causes osteoarthritis, the kind of job you do, being an athlete, and the likes. But then people might want to ask next, then how can we prevent this so-called osteoarthritis? Are there preventive measures so that one can just say, oh, okay, I'm trying to abstain or avoid having osteoarthritis in the later future? Are there preventive measures at all to this illness?
Well, there are preventive measures. You see, those preventive measures, they may not be 100% effective.
Okay.
But sometimes it may delay you having osteoarthritis, and also, even if you have it, it may reduce the severity. Even there are some of my patients, they've done everything preventive, they still end up having it. But it's better for you to start those things early,
okay,
than to you to wait until you are 65, 17 years and it becomes very severe. So there are some basic things we need to do. We call them lifestyle modifications.
Lifestyle modifications.
So what does it involve? Whatever you know that when you do it, it increases or it makes life unbearable for you, or it increases your ability to have some health issues. It can be hypertension, it can be diabetes, the same principle we use. So some of these lifestyle modifications: one, weight control.
Weight control.
You can control your weight. And it's very simple. Try to do 1 or 2 physical activities. I'm not saying you should go and run marathon. You can do brisk walking, just some minor exercises. You understand. Then also work, the kind of work you do too. If you notice that you are involved in a kind of job that involves a lot of physical activities, walking, standing for long, and you started having these symptoms, such that even if you stand for like 10 minutes, the pain is so severe that you have to sit down. Then at that point, you may need to do 1 or 2 changes. Maybe you are that type that where the department you are has to do with a lot of physical activity, standing. Wherever you work, they can move you to another department whereby you do less of physical activities, and you still be very, very effective. Then, for those people that has to do with their own, has to do with family history. There's some familial predisposition. When you notice such, that your father has or the mother has osteoarthritis and it's very severe, the elder brother is having, then you're already maybe like 35, 45, you're having similar symptoms like your father or your elder brother, then you have to seek medical advice early. You have to seek medical advice early. So there are a lot of things we can do, but those are just the basic things. Lifestyle modification.
All right, you've heard that from our doctor guest today. Lifestyle modification is very germane. It's important. Exercise as well is something that is very, very necessary out there. We will still go through the practical side because I see that there is, I don't know what this is called on the table, but so let me just quickly rephrase that question. Mr. Wale there is saying that he is a man of over 75, and then every single morning, every day, he has to walk through the hills in his area. But people encourage him and say, oh, for a man of 75, you are doing well. It's good exercise for you. Well done, sir. But for you as a doctor, do you think this is good and okay?
Well, for his age, I would say it has both a positive and a negative side. Now, if there's any activity, physical activity that increases your pain and make life uncomfortable for you, I will not advise you to continue. Because the kind of exercise we are talking is, it has to be a supervised and a structured exercise. That's where a physiotherapist needs to come in to advise you. Now, the mechanism of the knee involved in climbing staircase is different from the mechanism of the knee involved in running, involved in walking.
True.
Because inside the knee, there are many structures. The knee is one of the most complex joints. If you look at, I have a, just that we are not on TTV.
Yes, but this is also going to be shown.
Yes, I have some specimen here. There's a part you called the meniscus.
The
like
meniscus.
Yes, that is like the cushion of the knee.
Okay.
So the bone at the top, the femur, and the one down, the tibia, where they meet, there's a cushion there which you call the meniscus. So the meniscus, like the cushion, it absorbs the shock. It's like what you like. It's like the shock absorber you have in your car.
Okay.
You understand? That's why sometimes when your shock absorber is bad, you enter pothole, you hear gaga.
Yeah, there's this.
The mechanic will tell you that yes, the shock absorber is bad. You need to change it. The same thing happens to human knee. There's a part we call the meniscus. So as you are getting older, all these the ligaments degenerate. Initially it's as big as this. As you are getting older, it gets smaller, it thins out. The time will come, it's almost completely gone. So when you are walking, the two bones tend to rub on each other. So if an elderly person is climbing staircase and it's not comfortable for you, I will not advise that you continue. There are also other exercises you can do that will be beneficial to you. Sometimes when you do some of these changes activities and you now come back to the climbing of that hill, you find that you may not feel the pain, because there's a part of the knee you are using to climb that you are causing discomfort to internally. So that's where the pain may be coming from. So if it happens that you are feeling pain and you're not comfortable climbing, I would not advise you to continue, because it may cause more damage to the knee joints. So there are other exercises you can do. You can do brisk walking. As an elderly person of 70 something, you don't need all those strenuous exercise. What you need is just mild exercises to keep your joints mobile, free. So another thing I can tell you is that if you have the opportunity of relocating to a level land,
a more comfortable
environment, better for all of us. So that's my advice.
Thank you very much, Doctor. And to Mr. Wole, who called in Babadi, you've heard the medical advice. That is no longer exercise. It is as equivalent as somebody
discomfort.
saying, yes,
punishment.
We have some that will go through hunger strike and say they are fasting.
Yes.
So there's a difference between exercise and discomfort.
Yeah, like fasting without prayer is a hunger strike.
It's hunger strike. Exactly. That's what I actually wanted to say.
Yes.
You know there is no food and you just convert it to fast. It's not a fast. 0904081161 or 0904082161. If you have questions to ask our doctor today, please feel free to call in and ask. He will do justice to your questions as regards the joints, the bones in our body system. Now, you've talked about how these things can be prevented, and you emphasized majorly, on the lifestyle of ourselves and exercise too as well. This would then bring me down to, in as much as it could be prevented, you would also agree that there are people currently as we speak, you have clients, I don't know if the word is client or patients.
Patients, clients. These days we used to, in more advanced countries, they use the word client.
So you have clients at this time that are actually going through the pains of osteoarthritis. How can it then be managed? Can you put us through a sketch of how this illness can be managed?
Yes, I think that is the cocoa of the...
Exactly.
That is the cocoa of the... That's what everybody wants to hear.
True.
Yes. Well, like I've said earlier, osteoarthritis affects all joints of the body
Mm.
at different severity and based on the symptoms, the age, and the clinical presentation. First
Mm.
is for you to see a doctor.
First, see a doctor.
See a doctor.
Mm.
Because there are some cases that some patients may just come and they will just feel that it's a mild, mild pain. And when we investigate, we find out that it's more than that.
Mm.
So never assume that whatever pain you have in your joints is just something you can just overlook.
Mm.
And the other thing is that the earlier we start the treatment, the better.
Mm.
That's what I always advise all my patients. First is for you to consult with a doctor. You can see a general practitioner. If you don't have access to see a specialist, orthopedic surgeons, because we are just few in the country presently. A lot of my colleagues have traveled out of the country. So if you have opportunity of seeing an orthopedic surgeon, better. First, you have to see a doctor. You can see your GP. The GP can start the treatment, and if you find out that what he cannot undo, the general practitioner then cannot refer you to orthopedic surgeon. But if you have opportunity of having an access to orthopedic surgeon, just as we have in the Ikorodu General Hospital, we have orthopedic surgeon on ground. So you can come and see us, then we know what to do. First, the doctor will see you. You give the doctor the history, when it started, how it affects your life. So when he takes the history, he will examine you, examine your joint. It could be the knee joint, it could be the hip joints. The next stage is to do what is called investigation.
Investigation.
Yes. Investigation is not police investigation.
This is body investigation.
Body investigation. So it's to check in which first, the most common thing we do is what we call the radiographs. That's X-ray. Let me just keep it simple.
Yeah, the
X-ray.
common word
At least
is
all of
X-ray.
us know what is called X-ray.
Exactly.
Let's keep it simple. But we that are into orthopedics, we use the word radio.
Yeah.
You do an X-ray of the affected parts of the body. It could be the knee, it could be the hip. From there, that is the basic one. Then sometimes we may need to do other investigation.
Okay.
We call them auxiliary investigation, supportive investigation, to make more specific diagnosis. So when you do the X-ray, we look at it. So it can be the X-ray. Some people they have multiple. Some people, the osteoarthritis can be very unfair to some people. Honestly, the same person that have osteoarthritis of the hip, has osteoarthritis of the knee, has osteoarthritis
Just
of the
one
shoulder.
person.
One person, I've seen it.
Wow.
So we call that polyarthritis. So the management of that one is multidisciplinary. Because it's not only the doctors that manage osteoarthritis.
Okay.
The physiotherapists are part of us, the nurses are part of us. So it's a teamwork. So it's not only the doctors. So when you do the X-ray, we look at it. From there, we can be able to classify osteoarthritis.
Okay.
We have different grades. Just as I have here. It can be a mild osteoarthritis. We have terms we use for them.
Okay.
Grade 1, 2, stage, and all this stuff. So up to 4. We have the mild osteoarthritis, we have the moderate osteoarthritis, and we have the severe osteoarthritis. The worst of them is this severe osteoarthritis. In this, the joint is almost completely destroyed. All the cartilages is almost gone. If you look at this diagram, you can see. If you look at the diagram here,
yes,
you can see this red part shows that the injury has extended into more than the articular surface. So this red part you are seeing here are part of the bone. There's something
this
covering.
This red part is part of the bone.
Normally you are not supposed. This is the normal. This is the normal one. Normally you are not supposed to see the bone from the articular surface. But due to the fact that the patient has been having severe osteoarthritis, the surface has been eroded.
So when it gets to that point, it has gotten bad.
Yes, right. This one is very bad. Even this people with this kind of knee, they can find it difficult to walk.
Wow.
When they sit down, they may want to remain in such position. So this one can lead to disability, what we call disability. To go to work is difficult, to even come out, to go to toilets, some of them can be very, very bad. Then when it gets to this stage, the knee will start getting bent. There will be bending of the knee. That's what we call deformity. It can either be a K leg or a bow leg. The K leg, we call that valgus genovargus deformity. The bow leg, we call that one genovargus deformity.
At an old age.
Not even in younger people. If you have very bad osteoarthritis, after destroying the knee, because the knee has to bear the weight of the body. So the body is looking for a way to redistribute the weight.
The load, yeah.
The load. So in the process of doing it, it's just like you have the pillar of a building, of a 10-story building. If the pillar is getting overloaded, what will happen? The pillar will start bending. The same thing happens to the knee joints. So in an attempt for the body to redistribute the weight, so the knee will start giving way. It's either forming a K leg or a bull leg. So you can see all these things. All these things you are seeing, they are osteophytes. They also yes, it's called osteophytes. They can be at the front, they can be at the back. So they contribute to the pain. All these are called osteophytes. In addition, it causes a lot of discomfort. It causes a lot of discomfort. So when you now get to this stage, but unfortunately, in this part of the world, Lagos, Nigeria, we don't usually see them at this early stage, this mild stage. It's either they come when it's moderate or severe. So it makes the management or the treatment much more difficult.
That is why it is okay for early diagnosis. It is best.
Yes, early diagnosis. So by the time it's getting to this advanced stage, the treatment or the method of management is entirely different. There are some times, apart from the, let me just digress a little. Okay. I told you there are a lot of structures in the knee. Apart from the bones, most especially in younger people, they have features similar to this arthritis and so on and so forth. Apart from the bone, there are other structures there. The meniscus is there, or the menisci, or the meniscus is there. The cruciate ligament is there. All those things need to be managed, especially in younger people. But that one is a different ball game. But when it comes to osteoarthritis, we are talking more of degenerative changes.
Yes.
The articular surface is going, it's eroding into the bone. There's friction. Is that friction there that is causing the pain? The friction between the two joints, the two bones, is what is causing the pain. And there's a fluid. I told you there's a fluid.
Yes.
Just like you have engine oil.
Yes.
Or you have grease.
To grease
ball
and
socket
make it
joints.
easy for flow.
Yes.
Free flow.
Yes. So those fluid, called the synovial fluid, dries up. So there's more friction. So whenever you move, the bone of the femur rubs against the bone of the tibia, and there's severe pain. So when it gets to this stage, the symptoms here in this severe stage is different from what you have in the mild stage. The mild stage, the patient will be having pain, recurrent pain, but he's still able to go to work, do his basic thing. The man can go to shop, go to market, Sabo market and all those Ikodu market, and do his business, do his or her business. But when it's getting to this severe stage, that's when it becomes a major problem. So it becomes the situation or the condition affects our daily activities. So unfortunately, this is where we pick most of them.
Okay, let me interject you a little bit, Dr. Oloyede. There are situations or cases where this commonly, I think I've heard and seen from our mothers, women, where they'll just tell you that this leg is always paining them. Help me rub this, all this balm without mentioning their names. Help me rub this balm and this. And before you know, they'll tell you it has gone. 3 days later, they still come and say, help me rub again, it's paining and all that. So what I want to ask, my next question is this. If we talk about osteoarthritis, is it a curable illness? We have some illness that when they come, Yorubas will say, the baraku, you just have to start managing them. Yes. Is this same with osteoarthritis, or is curable and when it's gone, it's gone?
You're 100% right. See, osteoarthritis is a degenerative process, meaning that it's an aging process. So you are just saying you want to cure osteoarthritis, you are saying you want to reverse the age.
You want to return back to your younger days,
yes,
which is impossible.
We are not God. Doctors are not God.
So it can only be managed.
We can manage it. When you manage and you manage over some time, there's a possibility that the rate of degeneration may reduce. Even in some cases, there's some level of regeneration. But for the elderly people, the ability to regenerate those tissues are very, very low and poor. If it's a younger person now, well, much maybe you and I, when you manage such case, the rate of improvement is better. But for people that are at certain age, because osteoarthritis is otherwise known as aging disease of the joints.
Aging disease of the joints.
Aging disease of the joints. So what we can do, we can manage and make life comfortable and better. There are some patients, if you take away their pain, they are okay. It's mostly the pain that brings most of our patients to the hospital. So if you apply balm, some of those balm, well, they are effective. Some they may just give some temporary relief.
Yeah, just for some days.
For some days. But the main cocoa that is causing the problem is still there. So it will help. Because if somebody has pain, you cannot just say the person should just be at home crying. If he has there's a cream called diclofenac, they can apply it to soothe it first. But you still need to come and see the doctor.
Mostly used by athletes, yes. Now, let's now talk about another angle entirely. It can only be managed. It cannot be cured because it has to do with the age. Looking at the treatment and the management of osteoarthritis, it is something that, like you said, they don't always come until it has gotten bad.
Yes,
so the belief for some is because it's expensive to afford. When I go to the hospital now, they will say I should go and bring one big money. How affordable is it to treat or manage this illness?
Well, I will not say treatment of osteoarthritis is cheap. I will not say treatment is also expensive. It depends on the stage in which the patient presents.
Okay.
If you come at the early stage, of course, we just do some basic things. We give medications, physiotherapy, teach you on some lifestyle modification. Somebody that comes with stage 1 is different from somebody that comes with stage 4. Just like cancer.
Yes.
Someone that comes with advanced cancer with metastasis, the thing has spread to the lungs, to the brain, and other parts of the body. It's different from someone that comes with cancer that is localized within that location. So the treatment of early cancer and late cancer can never be the same.
True.
The same thing applies to osteoarthritis. All these early stages, they are much easier to manage. Sometimes we just give them drugs, physiotherapy, lifestyle modification. Sometimes we give them braces to support the knee. And so even some people may come that where they are working, it has to do with standing job, this is that. We do our own investigation. We review the patient, do some treatment, and we can recommend that, okay, if the person cannot fit into this place, he can move to another department. It's part of the management process. Then for people with severe osteoarthritis, now, if you want to manage patient with severe osteoarthritis, this one is already a complicated case.
Yes.
What you have to do for this patient is 100% different from what you have to do for this patient. This first one with mild, medications may suffice. But most time people don't come with mild. They must have been taking drugs. When you take some medication, the thing goes for 1 week, 2 weeks, 3 weeks, 4 weeks.
Or the painkiller drugs.
Yes. And the point with painkillers, most of those painkillers are what you call NSAIDs, non-steroidal anti-inflammatory drugs.
Please break that down. Now I am so lost.
That's why I don't want to speak too much of all this.
Please don't. Please don't.
I want to keep it as simple because of our audience. Because I know most people are listening from the market, from their place of work.
Yes.
So those are drugs we use. Example of non-steroidal anti-inflammatory drugs. You have ibuprofen. All of us know ibuprofen now.
Yes. We are doing this. Let me just quickly make people understand that we don't promote brands, but we are doing this for the benefit of the learning process.
No.
Yes.
Ibuprofen is a general term for that class
category
of
painkillers.
Yeah, just like you say antibiotics.
Okay.
You understand?
Yes, okay.
It's when you now start mentioning the brand name, the company that manufactures.
That is when it's yes. Okay.
There's something called generic.
Okay.
Generics.
Beautiful.
So ibuprofen, diclofenac, they can be using it. They can go to pharmacy.
Are you saying these drugs are harmful to our health?
Yes, because
these are drugs that a lot of us take.
If you take it for too long, like those NSAIDs, ibuprofen, diclofenac, piroxicam, they can cause ulcers.
Wow.
it can cause ulcer because in the process of those drugs working, they give some side effects.
Wow.
So that's why some of those drugs we don't give it for too long. Or sometimes when we give them for 1 week, 2 weeks, we withdraw it. Then if the patient need another dose, we start again. But there are some drugs we can give to protect the stomach.
Then, Dr. Oloyede, what do you have to tell to people who are out there that, for instance, there's this drug that is prescribed to them, and then after using it, it works for them. They no longer come to the doctors to ask for another. They just say, I always use that drug, go man, share for me, and they continue using such drugs.
Well,
because this is the case right now.
That's the Nigerian factor.
What would you say to people like that?
We always have shortcuts to everything. The truth is that drugs are good. They also have their bad parts, which you call the side effects. So if a drug is working for Mr. B, it doesn't necessarily mean it must work for Mr. C. Because no two human beings are the same.
True.
Somebody may use a drug and is doing well. Other person may use it and will react to almost to the point of going. So people are different. So what works for Mr. A may not work for Mr. B. Let's come back to.
Oh yes, please. Yes, please.
Now, there are various modalities for managing osteoarthritis depending on the stage, the age. There are several factors. There's an algorithm for that. There are several factors. Now, let's concentrate on, because most of our patients, they come at the late stage. When the patient presents at the late stage, it's already advanced.
Okay.
So you have to do something that is
extra.
Because this patient, before the patient came to you, the patient would have gone around, buy all sorts of things. Some of them even go to others have gone to all these traditional people,
the local
they will stretch it and all those things. And sometimes they may cause more injuries. So when they come like that, they want something extraordinary, not just giving them drugs. Especially when they come to government facility. I can tell you for sure, as a consultant at the Kogi General Hospital, if I see 10 patients, at least 8 or 9 have gone to see other doctors. I've gone to take treatment from one way or the other, traditional pharmacies, pharmacy shop, chemists. So when they come, it's not just what you just treat. Now, treatment modalities for osteoarthritis ranges from lifestyle modification to operative management. Yes, some cases you need to do operation. Because at that point in time, no matter what you do, you give drugs, do physiotherapy, it will not work. That's already an advanced stage. So what we usually do for this advanced stage of osteoarthritis that has become very difficult for the patient to maintain his normal life. When the pain has started affecting the lifestyle of the patient, I've seen some cases that the patient say, this pain is too much, it's short, I feel like dying, I shouldn't die. We don't like to get to such stage. Now, one of the final stage in terms of management of severe osteoarthritis is what we call arthroplasty. For the knee, because the knee is the most common. There's what we call the total knee replacement. Or for those of the surgeons, it's called total knee arthroplasty. Those are for the advanced stages in which there's nothing you can do. What does this involve? These articular surfaces, these parts, and these parts, this is the femur. This part is the femur, the upper one is the femur, the lower one is the tibia. Where the problem is coming from is from this surface. And as far as these two are rubbing together, there will be pain. So what we usually do is to replace this surface.
It is replaceable.
Yes, that's why it's called the total knee replacement. You replace this surface and this surface. You put an artificial covering. Instead of the two surfaces touching and causing pain, is the covering, the synthetic covering here. So what we do, we open the joints. It's a major procedure. You open the joints, you take off the surface here, It's called a knee prosthesis. Take off this surface here. You come to the other one that is down the tibia. You take off the surface and you line it. Then, if you look inside this place, you can see this ligament here. There's also the artificial form of this ligament.
Okay.
It's a form of it is designed to take over the function of this. You know, this is the natural one. But in the process of the degeneration over the years, this thing is called the meniscus. You have the left and the right. It's gone. I told you earlier, this thing serves as a cushion, like a shock absorber.
Yes.
So when this thing is gone, whenever you are moving, you are stepping, the two will be hitting each other. So there's another one, artificial one we use. It's called the tibial insert. So you take this one off, you put it, it's like a plastic like this. All those things come from abroad.
Okay, Dr. Oloyede, if you're listening to us so that you will not feel lost, there is always a repeat broadcast, most especially on health matters such as this one. So you can do well to check our Facebook page. You will see a video after this broadcast later on in the hours of today. You will see the video there. You will see the perfect description of everything that is being talked about in the studio today. You can also check it out on our YouTube page, IKD 106.1 FM, as well as that of General Hospital Ikorodu. It is unfortunate that, again, just like the last time, time has cheated us and we are not able to balance it. But then, I just want to ask, how easy is it for anyone out there, because I know a lot of people have heard your voice, how easy it is for General Hospital? What are the times of opening as regards this department? But let me see if we can squeeze in just one call. Just one. Hello. Because of our time, what he is saying now is that I think he might be somebody that does not have the opportunity of shifting from one department to another. So what are the supplements that such a person in that department can go through or use?
Well, the issue of supplements is how will I say, it's a 50-50. But most of us that are into orthopedics and trauma, we don't believe so much in the supplement. Well, there are some things you can take, some that also help in regeneration. But most of them, they are not that effective, especially when it's getting to the level of moderate to severe osteoarthritis.
Okay, so Mr. Monday, could be maybe Mr. Monday or Friday.
Try and see your doctor.
Yes,
please.
That is exactly what I wanted to say. Try and see your doctor. Talking about your doctor, General Hospital Ikorodu, osteoarthritis. How easy is it for anyone to walk in and say, I want to see my doctor, my joint is this, my body is doing it this?
Yeah. Well, thank you very much. General Hospital Ikorodu is like a regional referral center within this ASIS. So most of the patients or some of the other general hospitals, private hospitals, they do refer patients to us. If you are coming for the first time, you have to go to what is called the general outpatient department.
Okay.
So that's where you present. That's where they do sorting of patients. So when you see the general practitioners there or the family physician there, they will now refer you to the orthopedics department, where you now come to us. We now streamline your management specifically to meet your needs.
But you people are very much accessible when it comes to
our clinic days. Yeah, our clinic days are Tuesdays and Thursdays. So I just left the clinic today is Thursday.
Yes,
I just left the clinic.
And we of course appreciate that. So if you're listening, you can go down to General Hospital and hold Dr. Oloyede. Just he's a consultant orthopedic surgeon. He sure knows his onions well. I want to thank you very much. I hope to see you again anytime soon.
Yeah, thank you very much.
My name is Opeyemi Adebambo. This is how far we can have it on the issues. Remember, your health is important. Health, they say, is wealth. It's a bye for now.